Hey, I'm Dr. Anthony Fauci, and I need to talk to you about something that's affecting over 100 million people worldwide right now. Two conditions that look similar on the surface, but they're actually completely different diseases that require completely different approaches to treatment. I'm talking about osteoarthritis and rheumatoid arthritis. Now here's the thing that most people don't realize, and this is critical. If you get the diagnosis wrong, you could end up treating yourself for the wrong condition for months, even years. That's not just frustrating, it can actually make things significantly worse. In fact, getting this wrong can lead to permanent joint damage that could have been prevented. So I'm asking you to stick around, because in the next 20 to 25 minutes, I'm going to break down exactly what these two conditions are, how to tell them apart, the specific warning signs you need to watch for, and most importantly, what you can actually do about it if you or someone you love develops one of these conditions. Welcome back to the channel. If you're new here, I'm Dr. Fauci, and I've spent my entire career helping people understand medical conditions so they can take control of their health and make informed decisions about their bodies. Before we dive deep into the differences between these two types of arthritis, I want you to know exactly what you're going to learn in this video. By the time you finish watching, you'll understand what osteoarthritis actually is at the cellular level and why it develops. You'll learn what rheumatoid arthritis really does to your body and why it's an autoimmune disease. You'll discover the key differences in symptoms between the two conditions. You'll know who's most at risk for each condition based on age, genetics, and lifestyle factors. You'll be able to recognize the early warning signs so you can catch them early and get treatment before permanent damage occurs. You'll understand what blood tests doctors use to differentiate between them and what those results actually mean. You'll learn why treatment is so dramatically different for each one. You'll get practical lifestyle changes that actually work for both conditions. And finally, you'll hear about the latest medical advances that are changing how we treat these diseases, including some breakthrough technologies that have just been approved by the FDA. Okay, let's get started on this journey to understanding your joints. Let me begin with osteoarthritis, because it's the most common form of arthritis, and honestly, most people will deal with it at some point in their lives. In fact, it's the second most common condition affecting Americans after heart disease. Osteoarthritis is what we call wear and tear arthritis. Think of it like this: your joints have cartilage, which is smooth, slippery tissue that covers the ends of your bones. Cartilage is essentially nature's shock absorber and lubricant. It allows your joints to move smoothly and painlessly, kind of like how oil on a hinge keeps it moving smoothly without squeaking or sticking. Over time, through use and age, that cartilage gradually breaks down. This process happens to everyone to some degree, but it happens faster in some people than others, depending on genetics, weight, activity level, and previous injuries. When the cartilage breaks down enough, the protective layer wears away, and bone starts rubbing directly against bone. When bone rubs against bone, that's when you feel significant pain. This isn't an autoimmune disease. Your body isn't attacking itself. Your immune system isn't involved at all. It's purely the natural wearing down of cartilage over time, kind of like tires wearing down on a car the more you drive it. Most people over the age of 60 have some degree of osteoarthritis on X-rays, though not all of them have pain. It tends to affect the joints that bear weight and get the most use: your knees, hips, lower back, and hands. These are the joints that take the most stress over decades of life. Now, rheumatoid arthritis is a completely different animal, and this is crucial to understand. This is an autoimmune disease, which means your immune system is actually attacking itself. Specifically, it's attacking the lining of your joints. I want you to really understand this because it's absolutely critical. With rheumatoid arthritis, your immune system mistakenly identifies the synovial membrane, that's the protective lining around your joints that produces the fluid that lubricates them, as a threat, as if it were an infection or foreign invader. So it launches an attack against it. This causes inflammation, which leads to pain, swelling, redness, and warmth in the joints. If left untreated, this chronic inflammation can actually permanently damage the joint structure itself, the cartilage and bone. The tricky part is that we don't completely understand why some people's immune systems do this. It's likely a combination of genetic factors. Certain genes make you susceptible, and environmental triggers like infections or smoking, but we're still researching this actively in labs around the world. What we do know is that once it starts, without treatment, it tends to get progressively worse and can cause permanent, irreversible joint damage. Here's where it gets important for you to know the difference, and this is something doctors use to help make a diagnosis. Osteoarthritis is usually localized. You might have it in your knees and your hips and your hands, but the pattern is often different on each side of your body. You might have it worse on your left knee than your right. Rheumatoid arthritis, on the other hand, is typically symmetrical and systemic. What does that mean? It usually affects the same joints on both sides of your body in the same way. Both hands, both wrists, both feet, both ankles. It's symmetrical, and it can actually affect your whole system, not just your joints. Rheumatoid arthritis can affect your lungs, your heart, your blood vessels, your skin, and your eyes. That's what we mean by systemic. It's not just a joint disease, it's a whole body inflammatory disease. This symmetrical pattern and systemic involvement is one of the biggest distinctions that doctors use to help make a diagnosis. Let's talk about the symptoms, because this is where a lot of people get confused and sometimes delay getting diagnosed. With osteoarthritis, the pain typically starts gradually, slowly over months or even years. You might notice a little stiffness in your knee when you first wake up in the morning, but it usually gets better within 30 minutes as you move around and warm up. The pain tends to get worse with activity. The more you use the joint, the more it hurts. And it gets better with rest. You might hear creaking or grinding sounds in your joints when you move them. We call that crepitus. It sounds kind of like gravel crunching, and it's caused by the rough cartilage surfaces grinding together. Your joints might swell a bit after activity, and you might notice the swelling goes down after resting. But here's the thing that's really important. Osteoarthritis doesn't usually cause widespread fatigue or fever or feeling generally unwell. If you're feeling exhausted for no reason, running a fever, or feeling generally ill, that's pointing more toward rheumatoid arthritis. Rheumatoid arthritis presents very differently, and the onset is often much more dramatic. The pain often comes on suddenly, sometimes even overnight. Patients tell me they go to bed feeling fine and wake up with severely swollen, painful joints. The morning stiffness with rheumatoid arthritis lasts much longer than with osteoarthritis. We're talking 1 to 2 hours, or even more, sometimes lasting most of the day. With osteoarthritis, it might be just 15 to 30 minutes. And here's something really important that I want you to pay attention to. Rheumatoid arthritis often comes with systemic symptoms that osteoarthritis does not. People feel fatigued, exhausted even though they've gotten good sleep. They might run a low-grade fever. They lose their appetite. They feel generally unwell, kind of like they're getting the flu, but it never goes away. They might lose weight without trying. Some people describe it as feeling like they've been hit by a truck. This is because rheumatoid arthritis is an inflammatory disease affecting the whole body, not just the joints. The inflammation is happening throughout your system, and your body is expending enormous energy fighting its own immune system. Now let me tell you about the risk factors, because knowing who's at risk is actually the first step in prevention and early detection. For osteoarthritis, age is the biggest factor. As we get older, cartilage naturally breaks down over time. It's a gradual process. Being overweight is another huge risk factor because extra weight puts significantly more stress on weight-bearing joints. If you weigh 20 pounds more than you should, that's 20 pounds of extra force going through your knees and hips with every step you take. Previous joint injuries increase your risk significantly. If you played sports years ago or had trauma to a joint, a bad sprain, a fracture, that joint is more likely to develop osteoarthritis later in life. Your genes play a role too. If your parents had arthritis, especially in their hands, you're more likely to develop it. Certain occupations that involve repetitive joint stress increase the risk as well. Farmers, construction workers, and people doing repetitive physical labor see higher rates. Gender plays a role. Women tend to develop osteoarthritis more than men, especially after menopause. Rheumatoid arthritis has different risk factors, and it's important to know them. It's much more common in women than in men. We see about 3 times more women affected than men. It typically starts between ages 30 and 60, so it can actually hit younger people than osteoarthritis typically does. It can develop in teenagers and young adults, though that's less common. There's definitely a genetic component. If you have a family history of rheumatoid arthritis or other autoimmune diseases like lupus or type 1 diabetes, your risk goes up significantly. Smoking is a significant risk factor for rheumatoid arthritis, and this is something we know for certain causes the disease to develop in genetically susceptible people. If you're genetically predisposed and you smoke, your risk increases substantially. Infections might trigger the disease in people who are predisposed. Gum disease in particular has been identified as a possible trigger. And here's something interesting. Being overweight actually increases the risk for rheumatoid arthritis too, but for different reasons related to systemic inflammation in the body. Obesity itself is inflammatory, and that can trigger or worsen autoimmune conditions. Now, let me grab your attention with something crucial, because this is where we can make a real difference. If you or someone you love is over 50 and you're experiencing joint pain, or even if you're younger and having concerning symptoms, the next part is absolutely critical. The early warning signs are where we can make the biggest difference in outcomes. With osteoarthritis, you might notice pain that's worse in the morning but improves with movement. You might see some swelling in the joints, especially after activity. Your joints might feel stiff, particularly first thing in the morning. Over months to years, you might develop visible joint deformities, like bony bumps on your fingers called Heberden's nodes or Bouchard's nodes. The pain pattern is key. It gets worse with activity and better with rest. If you're having these symptoms, especially if it's gradually worsened over months or years, that's pointing toward osteoarthritis. With rheumatoid arthritis, the early warning signs are different and more urgent. You might have unexplained joint pain in multiple joints at the same time, not just one joint. You might feel unusually tired, even when you've gotten good sleep. This is fatigue that doesn't make sense. Your joints might be visibly swollen and warm to the touch. You might have persistent morning stiffness that lasts for hours. You might experience unusual fevers, usually low-grade, nothing dramatic. And here's something people often miss. You might notice swelling in your hands and feet that seems symmetrical. Both hands swelling equally, both feet swelling equally. You might notice your fingers getting puffy or your hands feeling weak. These early signs are where early intervention can make the biggest difference. If you catch rheumatoid arthritis early and start treatment within the first few months, you can often prevent permanent joint damage. But if you wait years to get diagnosed and treated, permanent damage may already be done. Now let's talk about blood tests, because this is how we actually confirm the diagnosis and differentiate between these two conditions. With osteoarthritis, there usually aren't specific blood markers. The diagnosis is primarily based on your symptoms, how your joints feel when we examine them, and imaging studies like X-rays or MRI. But here's what we look for on imaging. X-rays will show cartilage loss, bone spurs, and joint space narrowing where cartilage has been worn away. Blood tests are usually normal in osteoarthritis, which actually helps us rule out rheumatoid arthritis. That's actually useful information. Normal blood work points us toward osteoarthritis. With rheumatoid arthritis, blood tests are absolutely critical for diagnosis and are much more revealing. We look for something called rheumatoid factor, an antibody that's positive in about 80% of people with rheumatoid arthritis. We also check for anti-CCP antibodies, that's anti-cyclic citrullonated peptide antibodies. These are very specific for rheumatoid arthritis. We check your inflammatory markers, things like erythrocyte sedimentation rate, which we call ESR, and C-reactive protein, which we call CRP. These show how much inflammation is happening in your body. In rheumatoid arthritis, these markers are elevated. If these markers are elevated along with positive antibodies, especially anti-CCP antibodies, we're pretty confident about the rheumatoid arthritis diagnosis. Sometimes only one antibody is positive, sometimes both are. Sometimes neither antibody is positive, but the ESR and CRP are elevated, and the clinical picture is clear. We call that seronegative rheumatoid arthritis, and it's still rheumatoid arthritis that needs treatment. No single test is definitive, but the combination of tests, symptoms, and clinical examination gives us the diagnosis. This brings us to treatment, and this is where understanding the difference really matters, because the treatment is radically different. Treatment for osteoarthritis focuses on managing pain and maintaining function and mobility. We're not trying to change the underlying disease. We can't reverse cartilage loss, so we focus on helping you live well with it. We often start with over-the-counter pain relievers like acetaminophen or non-steroidal anti-inflammatory drugs, which we call NSAIDs, like ibuprofen or naproxen. Physical therapy is huge for osteoarthritis. Strengthening the muscles around your joints takes pressure off the joint itself and distributes forces better. Weight loss, if you're overweight, can dramatically reduce pain because you're reducing the mechanical stress on your joints. Some people benefit from injections directly into the joint. Corticosteroid injections reduce inflammation temporarily, or hyaluronic acid injections, sometimes called viscosupplementation, which acts like artificial synovial fluid and lubricates the joint. Heat therapy helps with stiffness and improves blood flow. In some cases, surgery might be considered, like joint replacement or arthroscopy, but we try less invasive options first. Rheumatoid arthritis treatment is very different because we need to actually stop the immune system from attacking the joints. This is disease-modifying therapy, we're trying to modify the course of the disease itself. We use disease-modifying anti-rheumatic drugs, or DMARDs. The gold standard starting medication is methotrexate, which has been used for decades and has a good track record of effectiveness and safety. These medications actually slow down or stop the progression of the disease. They work by suppressing the parts of the immune system that are attacking the joints. Biologics are newer medications that target specific parts of the immune system. TNF inhibitors, like adalimumab and etanercept, block tumor necrosis factor, which is a key inflammatory signal. IL-6 inhibitors block interleukin-6. JAK inhibitors are newer and block specific proteins called Janus kinases that lead to inflammation. These biologic medications can be incredibly effective. We use NSAIDs for pain and inflammation management and sometimes low-dose corticosteroids for short-term pain control. But the key difference from osteoarthritis treatment is that we're not just treating symptoms with rheumatoid arthritis. We're treating the underlying disease process to prevent permanent joint damage. Here's where it gets really exciting, because treatment advances in rheumatoid arthritis have been remarkable. In fact, just recently, the FDA approved a completely new type of treatment that nobody expected would work this well. It's a device that uses electrical stimulation to activate your vagus nerve. The vagus nerve carries signals between your brain and internal organs, and when you stimulate it, it activates a reflex that tells cells in your spleen to stop making inflammatory proteins called cytokines. The device is about the size of a lima bean and is implanted through a small incision in the neck. In clinical trials, 35% of patients with rheumatoid arthritis who had not responded to even the most powerful drugs achieved meaningful improvement. That's remarkable for a group of patients who had run out of options. One patient, Lynn Milam, hadn't responded to any medications despite trying the latest costly immune drugs. After getting the vagus nerve stimulator, 3 weeks in, her elbow pain was completely gone. Her hands stopped hurting, the swelling went away. She went from not being able to hug her children or hold her husband's hand to being able to do all those things again. This treatment is utilizing the body's own mechanism for managing inflammation, and researchers think it might work for other autoimmune diseases too, like multiple sclerosis and psoriatic arthritis. Now, beyond medication and these cutting-edge devices, lifestyle changes are absolutely essential for both conditions. For osteoarthritis, regular low-impact exercise like swimming, walking, or cycling helps maintain joint function and keeps the surrounding muscles strong. Think of muscles as shock absorbers and stabilizers for your joints. Strong muscles mean less stress on the joint itself. Maintaining a healthy weight is one of the most important things you can do. Extra weight puts stress on joints, especially weight-bearing joints like knees and hips. Heat therapy can help with stiffness, especially in the morning. A warm shower or heating pad loosens things up. Cold therapy can help after activity when there's swelling. Eating an anti-inflammatory diet with plenty of fruits, vegetables, whole grains, nuts, seeds, and omega-3 fatty acids helps reduce overall inflammation in your body. Making sure your home is ergonomic, using proper chairs that support your back, adjusting your keyboard and monitor height, using assistive devices like jar openers can reduce stress on your joints throughout the day. Even things like wearing proper footwear with good arch support can reduce stress on your knees and hips. For rheumatoid arthritis, these lifestyle measures are important too, but the disease management through medication is more critical because without it, permanent damage happens. Anti-inflammatory diet is especially important for rheumatoid arthritis because you're fighting systemic inflammation. Mediterranean diet has been studied and shows benefits. Getting adequate sleep helps your immune system function better and recover from inflammation. Managing stress is crucial because stress can trigger flare-ups. There's a real connection between stress and autoimmune disease activity. Some studies show that certain supplements like fish oil and turmeric may help, though we need more research on these. Physical therapy is important to maintain range of motion and strength, but you need to be careful during flare-ups and work with a physical therapist who understands rheumatoid arthritis. And following your medication regimen exactly as prescribed is absolutely critical. Missing doses can allow the disease to progress and cause permanent damage. Let me talk about the latest medical advances because this is where things are getting really exciting in ways we couldn't have imagined just a few years ago. For osteoarthritis, there's new research on regenerative medicine. Platelet-rich plasma injections use your own concentrated platelets to promote healing. Stem cell therapy shows promise in early studies where we inject stem cells into the damaged joint to try to regenerate cartilage. We're also learning more about how to slow cartilage breakdown at the molecular level. Scientists have identified specific molecules and enzymes that break down cartilage, and there are several drugs in development that might actually block that process or even regenerate cartilage rather than just managing symptoms. A new experimental growth factor therapy appears to prevent worsening of osteoarthritis by actually increasing the thickness of cartilage in the knee joint. That's not just stopping damage, that's potentially reversing it. Genome-wide association studies have uncovered new drug targets. Surgical techniques are improving too, with less invasive arthroscopic procedures that preserve more of the natural joint compared to traditional surgery. The field of precision medicine is advancing too. We're learning to predict which patients will respond to which treatments based on their genetic makeup and inflammatory profile. For rheumatoid arthritis, the advances have been absolutely transformational. Just 20 years ago, many people with rheumatoid arthritis ended up disabled and in wheelchairs. Now, biologic medications have transformed this disease from one that often leads to disability to one that many people can manage completely, live a normal life with, and even go into complete remission. Newer biologics target different parts of the immune system, so if one doesn't work, we have options. We're getting better at identifying who will respond to which medication using genetic testing and biomarker testing. Combination therapy, using multiple medications together, often works better than single medications. We're making real progress on understanding what triggers the disease, which might eventually lead to prevention strategies. The American College of Rheumatology recently updated their guidelines to emphasize that the goal of treatment is to achieve remission or low disease activity. That's a huge shift in philosophy. We're not just trying to reduce symptoms, we're trying to get the disease completely under control. Here's what I want you to take away from everything we've discussed. If you're experiencing joint pain, especially if you're over 50, don't just assume it's normal aging or that there's nothing you can do about it. Get it checked out. See your primary care physician. Get the appropriate tests done. The difference between osteoarthritis and rheumatoid arthritis is huge, and getting the right diagnosis means getting the right treatment. Think of it this way. Osteoarthritis is wear and tear, usually localized, worse with activity, better with rest, usually with normal blood work. Rheumatoid arthritis is autoimmune, usually symmetrical, associated with systemic symptoms like fatigue and fever, and requires specific disease-modifying treatment. Early diagnosis and treatment, especially for rheumatoid arthritis, can prevent permanent joint damage. The window for preventing irreversible damage in rheumatoid arthritis is in the first few months after symptoms start. Don't wait. Even if you're diagnosed with either condition, there's so much you can do, from lifestyle changes to medications to newer therapies and even cutting-edge devices that can help you maintain your quality of life and stay active. If this video helped you understand arthritis better and gave you useful information, I want you to hit that subscribe button right now. We're constantly uploading videos about health conditions, treatments, and how to take control of your health. Knowledge is power, and I want you to have the knowledge to make informed decisions about your health. Leave a comment below and tell me which type of arthritis you're concerned about or if you have personal experience with either of these conditions. I read the comments and I value your stories because when you share your experience, you help other people realize they're not alone. And if you know someone who's struggling with joint pain or who's been diagnosed with arthritis and they're confused about what it means, please share this video with them. Knowledge is power, and sharing this information could help them get the right diagnosis and treatment. You might be helping someone avoid years of unnecessary suffering. Thanks so much for watching, and I'll see you in the next video.